Okay, that's great. You guys are letting me know where you're from. Obviously, a lot of Canadians, but we're getting representation from Tennessee, which, by the way, I hear is really a beautiful state for hiking. A friend of mine went there recently and thoroughly enjoyed all the great scenery. So I'm going to have to get out to Tennessee and Houston and from out west in Canada. So again, thanks everyone for joining. It sounds like most people are massage therapists or manual therapists. Obviously, that was the title, and that was kind of who I was trying to invite into today's seminar. So just to give you a bit of a brief background, I'm a chiropractor. I've been practicing for over 30 years. My background prior to that was in molecular genetics and molecular biology at University of Toronto. And I got involved with laser therapy over a decade now, and have been working in the clinic at BioFlex, and more recently now the medical director at the company. So today's webinar really is going to be focused on an overview of laser therapy and some case studies and specific information I've gleaned over the years with respect to massage therapists using laser therapy. And I also have a special guest with me, David Barker, a registered massage therapist out of Kingston, Ontario, Canada. And he's been using BioFlex for quite a while now. And so I thought it would be good to have insight from a peer, and you can ask questions from David as well. And that's towards the end of today's webinar. So again, if you have any questions as we go along, there's two ways of doing this. But what I prefer is that you type them into the Q&A box. The chat box is more of a general thing that everyone can see. But when you have a question for myself or David Barker, just type it into the Q&A box, and that way I can get to those questions. I will wait until the end of my section to answer my questions, and then I will do an interview with David Barker, and then you guys can ask questions along the way as well. So my background, I mentioned I'm a chiropractor, but I've actually been working with massage therapists my entire professional career. I've also educated massage therapists at multiple massage colleges in Ontario. Kikkawa College was the main one that I was at back in the day. I also started up the SOMA Institute, which is a massage college, clinical massage college in Chicago, Illinois as well. And I was one of the founders of that massage college. So I've worked closely with massage therapists over the years, and I've been noticing that a lot of massage therapists are starting to use laser therapy. In fact, we're finding here at BioFlex that that's probably the #1 profession that is using our equipment the last several years. Chiropractors do a lot as well, and physiotherapists, but we're finding more and more massage therapists for different reasons. And hopefully I can give you a bit of information about that as we go along. So really, what I'd like to do today is just go over for new people here what laser therapy is all about, the clinical applications for massage therapy, massage therapists, some case studies so you can have an idea of the results that you might achieve with our equipment, and then some specific insight into regulatory oversight, billing, fees, insurance, that kind of thing. You know, that's really important to understand. And then I'll bring in live David Barker, as I mentioned earlier, and we'll have time for lots of Q&A. We'll probably go longer than half an hour, just so you know, so you can be aware of that as well too. So let's talk a little bit about the origin of laser therapy. So it really goes back to this gentleman, Dr. Niels Finsen. He was a medical doctor from the Faroe Islands, which is a group of islands between Iceland and Denmark. And he was the first person to use artificial light, which is considered to be phototherapy, artificial light therapy, at the end of the 19th century. And he used it to treat conditions like smallpox and skin tuberculosis, also called lupus vulgaris. And specifically, he used red wavelength, he used blue and ultraviolet wavelengths, and he used carbon arc lamps with filters in them. Now, Niels Finsen actually won the Nobel Prize in 1903 in the category physiology or medicine. And specifically, it was in recognition of his contribution to the treatment of diseases, especially lupus vulgaris, with concentrated light radiation, whereby he has opened a new avenue for medical science. So really, this was the first use of artificial light specifically for medical conditions. And that's where it all kind of started with Niels Finsen. Now, lasers came along a little bit later. Lasers were developed in the 1960s. And the first wavelengths used were in the red spectrum. And they were used as hot or ablative lasers. And so they would burn the skin. In fact, the first clinical use was burning tattoos off the skin. And then they were used for laser surgery, dental applications, all those kinds of things where a hot burning laser would make sense. Now, if you can imagine a hot laser hitting your skin or tissue, it is very high temperature. So it would cause irreversible damage called photothermal damage. And you can see the zone. If you were to pinpoint and treat the tissue, then you would kill and destroy and coagulate and degrade proteins for a specific zone or area where you're treating, where it's high temperature. And that area is called high-level laser therapy, or that was the name given to it. Sometimes it's called high-intensity laser therapy because you're causing a thermal effect. Now, there's a zone outside of that where it's lots of red light, but no heat or minimal heat. And eventually that area was categorized as low-level laser therapy, where you have photoactivation. And I'm going to talk a bit about that as well. So it's this photoactivation zone of intense light, in this case red, that causes a beneficial or therapeutic effect, not a denaturing or damaging effect like a hot laser. So that's kind of where lasers start to fit into into this kind of therapy. But really, the person that really was a grandfather of laser therapy was this gentleman, a professor and Dr. Andrei Mester from Hungary. Now, he actually published a paper initially on the effects of ruby lasers, and he was actually trying to burn or get rid of tumor cells in the bellies of rats. That's what he was actually trying to do. But his laser was calibrated much lower than he anticipated. And what he observed, instead of actually sort of burning the tumors, he noticed a couple things. One was the hair or the fur grew back faster in the rat that was treated with this red laser. He also noticed the tiny incisions where he injected the tumor cells were also healing faster compared to the control. So his observation was that this red laser, which ended up being a low-level laser, had a healing effect and had an effect on metabolism of the hair follicles. So he actually went on to do more experiments. Specifically, he did some skin flap wound experiments. So I want to talk a bit about that because this is really important to understand what laser therapy is about. The first diagram that you're looking at is obviously a shaved abdomen of a rat, and he did two little skin flap wounds. You can see they're different sizes. This is a control rat. This was after about 7 to 10 days post-incision. And then he also had a similar rat, but he treated one of the incisions with that low-level red laser he used in the initial experiments. Now, if you compare directly the laser-treated wound compared to the control, you'll see that the wound is healing much faster when it was exposed directly to the low-level red laser. But what's really interesting is the other wound in the control, which you can see here, next to the laser treated, but not treated with laser, is also healing faster. So this is the main point that I want everyone to understand. And this is what Mester discovered. And all of our work to date is based on his observation that red, and now we also know near infrared wavelengths can stimulate wound healing when directly absorbed. But he also noticed that even if you have a wound adjacent to an area that's being treated, there's a beneficial healing effect. So he coined the term a direct effect and a systemic or remote effect of laser therapy. And it's important to understand that light can only go so deep into the body. If you're trying to heal tissue that lies relatively deep, which most conditions are, it's not because the light is actually going to that depth. It's because it's being absorbed by the circulatory system, specifically white blood cells, that helps control inflammation and helps wounds heal faster. Okay, so there's both a direct and a systemic effect. Now let's talk a little bit about the terminology. There's lots of different names for laser therapy. You can see them all listed here. Actually, there's over 70 names for it, but the current term used now is PBMT, or photobiomodulation therapy, and it's a form of light therapy that uses non-ionizing forms of light. It can be from a laser, but also can be from LEDs, a broadband light, and it's typically in the red, visible, and near infrared spectrum. It's a non-thermal process. You will never burn your patient using laser therapy or photobiomodulation therapy. And essentially how it works is there are endogenous chromophores or photoacceptors inside the cells, specifically mitochondria, that absorb the light and will cause a photophysical or photochemical reaction that helps the cell recover from inflammation and injury. This process is beneficial and will help reduce inflammation, reduce pain, accelerate wound healing, and tissue regeneration. That's why you would want to incorporate it into your clinical practice. Now, the spectrums that we use, as I mentioned, are red and infrared. If you look at the electromagnetic spectrum, there's the ionizing radiation like ultraviolet X-rays. That, of course, is very damaging to DNA and is harmful. But non-ionizing radiation has no ill effects and is safe to use on your patients, so you never need to worry about it causing any negative effect. Now, the effect of laser therapy or photobiomodulation comes down to the mitochondria. As we all know, mitochondria produce adenosine triphosphate and control the metabolism of the cells and the tissues that are trying to heal. So when your patient comes in with a muscle strain, a shoulder injury, an Achilles tendinopathy, whatever it is you're dealing with, there's inflammation, there's soft tissue damage that you're trying to accelerate the healing. Massage therapists, manual therapists, you're going to use your hands typically to help improve circulation and other physiological components to help heal faster. So that's a mechanical thing that you're doing. What light therapy is doing is actually being absorbed in the mitochondria, helping to increase ATP production, which stimulates other trickle-down effects inside the cell, including the release of nitric oxide and the absorption of calcium to help the cells recover faster. Now, I'm not going to go into the details. If you're interested, you can attend one of my workshops called Light Up Your Practice, or if you're in Edmonton in September 11th, attending the SOMA annual conference, I'll be there doing a full day training session as well. But the net result of photobiomodulation on the cell, as I mentioned earlier, is increasing mitosis or replication, repair and regeneration, reduction of inflammation, improving vasodilation and circulation. So you can imagine how it will be synergistic to what you already do. It also helps to immunomodulate the white blood cells, controlling inflammation and healing, reduces edema, very effective in lymphedema, by the way. In fact, it's an evidence-based guideline. It's one of the treatments in evidence-based guidelines for treating lymphedema. So if you do manual lymphatic drainage, your results will be that much better if you incorporate laser therapy, as well as having pain-reducing effects and helping modulate collagen secretion and scar tissue formation. These are all some of the things that laser therapy are going to do for your patients. As I mentioned earlier, we're looking at direct effects and indirect effects. So direct effect, I went through that a little faster. Let me just go back up here. Direct effect is when the light's absorbed directly by the cells and the tissues that are injured. Indirect is when the light's being absorbed by the blood or even the bone marrow, and the effects will go wherever that circulation goes in the general area that you're treating. So you can treat inside a knee joint indirectly through the effects of photobiomodulation. That's what makes this type of therapy so incredible and powerful to use. Now, as far as what you can use it in clinical practice, I think it kind of makes sense now that you can treat the entire musculoskeletal system, whether it's muscle strains, ligament sprains, tendinopathies, fascial tears, cartilage, joint degeneration, even fractures, bursitis, all these types of conditions that manual therapists like yourselves would be treating. You can add this as one of your tools in your toolbox. As I mentioned earlier, it's very effective for lymphedema and part of evidence-based guidelines. Excuse me. It can help on the nervous system, specifically for neuralgias, disc herniations, spinal stenosis, all of these types of conditions that you probably come across as well in your clinical practice. Cosmetically, it can help with aging skin. I think everyone has heard of these red light therapy devices like, Juve and all the rest of it on the bandwagon, trying to promote red light specifically for the aging aspect of skin. And in fact, it does help, but a lot of those devices I'm not recommending because they tend not to be on the skin, and a lot of the energy is reflected off the skin. If you're going to use light therapy, use it so it's touching the skin. Otherwise, it's probably not going to do a whole lot, or at least won't be as effective as when you touch the skin. It can be used for dermatological conditions, acne, eczema, dermatitis, psoriasis. Well, I know this is in your scope of practice. It's a good thing to know that these things can be treated as well. For wound healing, whether that's post-surgical or recalcitrant wounds, perhaps there may be clinicians in your office that do that kind of work. But there's also emerging clinical applications as well. Post-concussion syndrome, stroke recovery, even research on depression, autism. These are all emerging potential uses for photobiomodulation. We've seen it used for ulcerative colitis, irritable bowel syndrome, those kinds of things as well. Gut health, it really helps to improve gut health as well by reducing inflammation. And now we're starting to see it be used in fertility by different practitioners as well to reduce pelvic inflammation. And more recently, long COVID symptoms. There have been now studies to show that laser therapy can be very beneficial with some of the symptoms related with long COVID. And if you haven't seen long COVID patients yet, you will. The percentage is quite high. I forget what it is. Maybe it's 10, 20% of anyone that's had COVID may develop long COVID symptoms. And the more that you get COVID infection, the greater the likelihood you'll get long COVID. I'm not sure if you're aware of that or not, but it's still prudent to avoid getting infection, even though it's, it may not be that serious. Your body will react to it in a way that potentially will lead to long-term problems. It's a really weird virus. You don't want to get it, and you don't want to get it multiple times, even though you might think, oh, it's no big deal. It can be a big deal. Let's look at some of the case studies. These are mostly from our clinic. Things like treating a hematoma, hamstring strain. You'll see dramatic results by using our equipment over these injuries. things like Achilles tendinopathies. I'm not going to spend a lot of time or detail with these. I just want to get you an idea of what this type of therapy can do. Things like olecranon bursitis, quite effective, easy to apply. And again, when you're doing manual therapy, you can't really work directly on a bursitis like that. It's acute. So it's good to know that you can use something directly on that type of problem, for example. Post-surgical recovery, you might have patients that have had surgery looking to have some manual therapy, and you can add light therapy into the mix to help reduce inflammation and accelerate the healing of the surgical wounds or post-surgical wounds. Things like tears of meniscus in the knee. This was a case study done where the patient had a non-displaced vertical longitudinal tear of the posterior horn of the knee meniscus. And they did 20 sessions over 3 months. This was by Dr. Miguel Cruz, one of our BioFlex practitioners, a chiropractor. And 3 months later, a follow-up MRI showed that there appears to have been healing of the vertical longitudinal tear. I thought it was pretty funny that the radiologist was scratching his or her head saying that there appears to be healing because it's unusual for a meniscus to heal, especially that quickly and that completely in 3 months. And that's the kind of results that you can achieve with laser therapy. I know you have some questions. I would definitely get to those questions. Disc herniation. Of course, discs oftentimes heal. They usually take, in my experience, a year to 2 years to completely heal. This was a C6, C7 cervical spine on the left side, paracentral, follow-up CT, I believe, 8 months later. It would have been a series of treatments, probably 20, 30, maybe even more sessions. And the follow-up showed that that disc that was previously seen is no longer evident. So complete healing in 8 months, that is very good for a disc herniation. Things like fractures and sprains. This patient came in, turned over on his ankle playing volleyball, severe ankle sprain, a fracture of the 5th metatarsal. That's what it looked like upon initial presentation. About 3-4 weeks later, we got him completely healed. His crutches were tossed away, and he was back to normal function and weight bearing on his foot. Again, that's pretty good healing for a fracture and a severe sprain. Okay, so let's briefly, I know I'm going a little bit over time. Sorry about that. Let's talk about some regulatory oversight. In Canada, the provinces obviously regulate practice of massage therapy and other different manual therapists and different rehab specialists. And so therefore, there's different rules and regulations. Currently, all provinces, with exception of British Columbia and Quebec, allow massage therapists to use laser therapy, provided that you get adequate training. That's usually one of the points in the bylaws to say that if you're going to use modality, you need to make sure that you're trained in how to use it. And of course, that's not going to happen at the level of your initial training. At BioFlex here, we have a 6-7 hour series of webinars for training. Also, we have and host advanced trainings as well. So really, it's up to you to ensure that you abide by your regulatory or association bylaws. Not all provinces or states regulate massage therapy, so you would know what's going on for your particular area. So in some provinces, and the one that I'm most aware of is Alberta, they have what's called a radiation protection agency. It's mainly for like x-rays and stuff like that. But if you use a class 3B laser, you just have to register your device. It's no big deal. And it's important that you do that as well. Just, do the paperwork, not a big deal. They just want to ensure that if you're using class 3B laser, that it has potential eye damage, that you have the protective gear and training to do that. And that should be anywhere, and we train for that, because if you're using laser therapy and you don't have safety training, I don't advise it because there's potential for eye damage if you don't know what you're doing. Fortunately, our equipment is designed so there's no risk of eye damage because the equipment doesn't turn on until you hit skin or touch skin. And of course, we do the safety training and have goggles and glasses available as well. In the United States, there are some variances in state to state. So again, if you're in the United States, I basically have had not seen any issues where massage therapists are not allowed to use laser therapy. But again, there might be some different bylaws in cities or states that that either need you to register with the local agency or what have you. But most states, as far as I know, allow massage therapists to use laser therapy. So when you're integrating it into your practice, like any therapeutic service, laser therapy should be offered as a separate fee or as an additional fee to when you do manual therapy. On average, I'd say the billing's pretty close to massage therapy. So if you do $100, $120 for an hour, and you do 30 minutes of massage, you do the math, and that's kind of what you'd probably charge, but you may charge a little bit less if you're combining it with massage, that kind of scenario. The best fees I recommend are to be competitive with what you see locally with other clinics in the area as well. Third-party insurers will cover laser therapy. They don't distinguish what type of therapy you're administering to your patient or your client, provided it's within your scope of practice. So when you bill out, you would bill out for massage therapy, period. That's all your bill will show for. In your notes, you're going to note that you've done laser therapy, but it's none of the insurer's business what kind of therapy that you're actually doing. And to be honest, they don't really care as long as you're doing it legally and within your scope of practice. So whether you're a massage therapist, a chiropractor, a podiatrist, an osteopath, a naturopath, whatever it is, nearly all of them allow laser therapy in their scope of practice with those few exceptions I mentioned earlier. And then you can just bill for laser therapy, incorporate that in your bill. I wouldn't mention it necessarily because, the more you mention, the more questions they might have. And then you'd have to explain to them that it's okay that you can use laser therapy and all the rest of it. So again, regulatory bodies or associations may require specific requirements when submitting reimbursement from a third-party insurer. For example, in Ontario, you have to do a certain amount of manual therapy along with laser therapy to bill it and have it covered by an insurer. Okay, so every province will be different. Every state might be different. Some do, some don't. And there's gray areas there. And also you can make a case for when you're using our laser probe that you're doing a trigger point manually using the probe as well. So you can be a little bit creative. I'm not saying you're doing anything under the carpet, but you can be creative to some degree as well when you're doing that, because you're doing manual therapy as well when you're using a laser probe. And that kind of information I can give out during the training session, especially in Edmonton when I'm out there on September the 11th. If the client doesn't have an insurance, then those rules tend not to apply, and you can just bill for them directly cash to your patient or your client. But again, always confirm with your regulatory body or association as far as the rules. I cannot keep up to date with all the different geographical areas. It's not my job. It's your job to ensure what you're doing is okay, but from my experience from a decade or so, there haven't really been any issues. So as long as you understand that, you're not from British Columbia, massage therapist, or Quebec. I actually had to go to court in Quebec as an expert witness. And long story short, the physiotherapist there, they ended up preventing massage therapists from using laser therapy. It's unfortunate, but that's how it worked. Okay, safety concerns, very few. Don't treat over a growing fetus over the pregnant the pregnancy itself. You can treat away from the area, but not directly over the growing fetus. Obviously, you're not going to treat over cancer, suspected area of cancer, malignancy. You can treat away from the area, just not directly on the area. And of course, you're not going to irradiate the eye directly. Those are the main safety concerns. It's important to understand that there are no reported side effects of laser therapy documented in over 1,500 human clinical trials. It's safe. It's very safe. Okay, wonderful. I know I've gone a little bit over time, so I'm going to bring in my guest here, David Barker. So I'm going to ask him to turn on his video. Hi, David.
Hi, how are you?
Thanks for joining me. Sorry for running a little bit over time. David is a massage therapist, registered massage therapist out of Kingston, Ontario. Runs the David Barker Massage Therapy and Bioflex Laser Clinic. And he's been working with us for quite a while, and he's on vacation now. Are you still out in PEI, or where are you right now?
No, now I'm in Halifax.
Oh, Halifax, nice. So he's actually joining us on his vacation, so I do appreciate that. David, a few questions for you, and this is just for the folks listening in. Just curious how you got first interested in laser therapy.
So the first I heard about it was from a group of athletes that I was working with in Los Angeles. And they had, I mean, it's quite a word of mouth group. If you can heal quicker and get back to your sport faster, everybody knows about it. So they were talking about this system in Toronto that the Raptors were using and the Miami Heat were using. And I'm talking to guys from the LA Kings, and they knew I was coming back to Canada. I moved back here in 2012 for family reasons. My parents were getting older, and they said to me, as soon as you get there, you have to find Dr. Khan and his laser. So I did. I was actually at the Burlington Massage Therapy Conference. I believe that was in 2015, and met a group of people presenting there from Bioflex, and I think I was in training within 2 weeks from that.
Wonderful. You mentioned Dr. Khan. Fred Khan was our founder and CEO. He passed away last year. He was a vascular surgeon, but he had been involved with laser therapy and photobiomodulation for 3 decades now. So we definitely have been around quite a while. So another question is, when you took the training and you ended up starting to use laser therapy, how did you sort of integrate it within your existing practice?
Well, at first, I guess being cautious, trial and error, I got the system, I started using it on myself. And then I would use it. My brother is a fireman and always throwing his shoulder out. And I said, you got to try this. And so I started using it on friends and family, and then began to incorporate it in to the more difficult areas, or let's say I was not getting the results I wanted with just manual therapy. Lymphedema would be one of them that I can think of right off the top. And then the results were so fantastic, I just kept incorporating it into different pathology as we went along. Wonderful.
So did it change the way that you practice, or what would you say to that?
Yes. Well, it does change the way you practice, because now you have a tool that you're so confident with that it gives you, you know that you're going to help people regardless of how you go about it, but you can build a better treatment plan with the Bioflex laser being part of your toolkit.
Yeah, and you mentioned about limitations. You know, I've been practicing for a while now, and as I start to practice, I realized that you know, sometimes manipulation either wasn't indicated or tolerated well, or I wasn't getting the result I wanted. Then I got trained in acupuncture, and I was trying different things. I think it's important as you know, a healing profession, whatever that is that you continue to educate yourself as to how you can make your patients respond and heal faster and quicker, more efficiently, and make yourself a better practitioner. So I'm assuming that that's been a big part of your journey.
In a huge way. I can think right off the top of my head, a farmer came in from a rural community, and peripheral neuropathy, you couldn't touch his feet. They were burning and painful. And so initially, like, there was no way massage was going to work at this point. We needed to get that inflammation down and that burning sensation to a tolerable level. And we did that with lightly putting the arrays on and just running arrays to begin with. Later, I would incorporate in, I have both the red and the infrared laser probe, so I would incorporate in the red laser probe. And we got him to the point where, well, his tractor broke down 2 kilometers from his barn, and he was able to walk back the whole way without any pain. So that's pretty phenomenal.
Yeah, I mean, neuropathy, it does work wonders for sure. I'm curious as to your learning curve. I mean, you know, I do the education piece here and so forth, but just curious as to how long you felt it took to learn how to use BioFlex and then to sort of, you know, be confident with using it on your patients.
Yeah, the equipment itself is very easy to use. I did I think it was a 2-day in Toronto training in 2015, and I felt pretty confident to use the equipment at that point. Having said that, incorporating in for specific pathology, I was cautious, and I did a lot of reading. I mean, hey, if anybody wants to know anything research, David is the guy. And I know you got plenty of emails from me, like, do you have research on this or that? And David would send me in the right direction every time. And by reading and understanding what you're doing, you're going to feel more confident to incorporate that in for more difficult situations.
Yeah,
I don't know how long that particularly took. Maybe, I know within a year, we were purchasing the second system. So it was probably about a 6-month curve where I felt that I'd read enough and knew enough. But again, I'm still learning.
Yeah, and as you always should, whether you're just doing manual therapy or whatever it is, you should always be learning new things and so forth. So curious as to if you're noticing your peers using laser therapy a little bit more, and also to maybe how you approach marketing or educating your patients on laser therapy.
Yeah, so yes, I am finding that more RMTs, I get quite a few phone calls asking, is this something that I should incorporate into my practice? And even people that I went to college with, or even some of my college instructors, have moved away to the other areas, and they're reaching back to me, asking me how it's going. So I think we're on a real upswing of more RMTs finding it useful. And then again, what was the next question there?
Yeah, I guess like educating your patients. I mean, let's face it, like if a patient comes to see me as a chiropractor, they're thinking I'm going to crack their back or something, right?
Yeah.
And then if I'm going to do something else, let's say acupuncture, they can kind of understand what I'm going to do. But if I do something like laser therapy, it's a little bit different. So how did you broach that, especially as a manual therapist and people are coming in expecting, you know, manual techniques, and you go, hey, I'm going to do some laser therapy, and they was there any resistance, or how did patients accept that?
No, so actually, what I did do, and I think there's a video now that you can download from BioFlex. I created a looping video in my waiting room, and just had laser therapy videos and information going on in the waiting room. And a lot of people would ask, and I had pamphlets and information pages on it. And a lot of people would ask, even if it wasn't for them, oh boy, my father is really suffering from sciatica. Do you think this would help him? Right. So it began as word of mouth. And when I tried to, depending on the person, I mean, if you're speaking to somebody that's a healthcare professional, then you can go a little deeper into things. But I had different levels of explanation, even if you want to take photosynthesis as an example of the healing and energy properties of light. And I would keep it simple on that level, and just all you had to do is get the person to try it for the first time. And I know there's not guaranteed effects from the first application, but boy, I find there is a lot. So when someone, even if you can decrease their pain by 10% in one treatment, that's a lot for them.
Yeah, that's a good point too, is that one of the questions you get asked is like, how long does it take before a patient feels something, that, that kind of thing. And that varies, but many patients will feel better after one session, certainly after 2 or 3, typically. I find that's the case as well too, for sure.
I had a funny story where this fella came in, he was a big, tough guy, and came into my clinic, and he was a truck driver driving across the country, and he couldn't change the gears with the big air brakes, with his thumb not working properly, tons of pain. And I told him this could take 4 to 6 treatments, and he did 1 treatment and left. And I didn't hear from him again. I thought, I guess he didn't think it was going to be beneficial. Well, he showed back up in my clinic about 8 months later. And I said, I told you we have to get these treatments close together. He goes, oh no, my thumb was good in 1 treatment. Now I wanted to do my knee. So it can happen that quickly.
Yeah, for sure. Lots of really, really interesting anecdotes. As we're speaking here, there's been a few questions, and I'm going to just sort of mention a few things. As far as the educational stuff goes, if you're interested in learning more, I do these webinars twice a month. So, I have one on shoulder pain coming up. That's more for our consumer personal devices. Treating sacroiliac pain, like different ones. You can go to our website. I'm hosting an all-day training session in Edmonton at the SOMA Education Conference. So you can sign, if you happen to be going to that, you can sign up for that. On our own website, under educational events, you'll see introductory courses that I do live and host live to give you a lot more insight and detail into laser therapy. They're called Light Up Your Practice. And we have, of course, our certification training program, advanced training, master classes. They're all on our website. So I encourage you to start to watch some of these webinars. And David, I want to really thank you for your time today. Do you have any sort of maybe a final few thoughts on sort of what laser therapy has sort of done for your practice and your results over the last few years?
So results wise, I couldn't be happier. I looked at a lot of different laser systems before. I was told to go find the one that Dr. Kahn was using or had developed. And I couldn't have been happier with BioFlex and the education and the support. And I looked at other systems, and there are a lot of other systems out there being used, but there's nothing out there that I could even compare. Let's call this the Mercedes-Benz. So then it's and when you have that kind of equipment and that kind of success behind each treatment, you're able to get through the inflammatory processes quicker. You're able to get your patient back to living the lifestyle that they want to live. And that really comes down to it. That's what makes my heart feel good every day, is that we've got somebody out of pain and back to normal function and healthy living.
Wonderful. One thing that comes up too is, as far as integrating something like laser therapy, it would be my understanding is that your time doing manual therapy might be reduced a little bit. Do you find that physically on your own body has been beneficial at all, as far as longevity or that kind of thing?
I would imagine so. This is something that I really found interesting when I moved to Kingston and moving into manual therapy here. I had a lot of people warn me, oh, you know, the lifespan of your career is going to be 2 to 5 years. That's not the case at all. So let me say that first. I actually met a woman in Los Angeles that was a massage therapist in Chinatown. She was 70 years old and had been doing manual therapies for 50 years, and her family had been doing it for hundreds of years. And I felt like I was in a Karate Kid movie because I was asking her questions. She told me just to come to her clinic and she would show me how to do it. Right. So I followed her for a couple of days, and she really taught me the ergonomics of manual therapy. So having said that, it's not something I would say rely on to try and save your body, but you're definitely going to have less wear and tear on your own joints when you're incorporating laser therapy into your practice.
Yeah, that's the feedback I've had as well too. I do have some questions about, you know, the effects, say, for torn rotator cuff tendons. You know, in general, laser therapy is going to be beneficial for musculoskeletal disorders. You know, there are emerging applications for things like post-concussion syndrome and cognitive issues, central nervous system issues. There's some questions about that. Even with respect to Achilles tendinopathies, I think I don't know if you've treated many of those, but if you, and usually you get quite results as well, good results. It's not a panacea, but it works very differently than what you're used to doing. And when you start to incorporate into it, you'll see the benefits in your patients, and you'll get more referrals. You'll be able to you know, treat some conditions that maybe weren't commonly coming in, like, you know, arthritis or what have you, and can kind of expand that way as well. I know I've gone over time, so David, I really do appreciate you joining me today, and everyone for listening in. If you want more information, you can email myself, david@bioflexlaser.com. I took the liberty of putting up David's email as well, D. Barker.
Yeah.
Sorry about that. I should have asked your permission, but it's too late now. So you can pester David all you want. Well, maybe not all you want, but if you have specific questions for David, feel free to email him. And again, if you want to join me for other sessions, just go to our website. You can sign up for those as well. Hope you enjoyed today's session. And again, thank you everyone for joining in. Take care. Thanks, David.
Okay.
Bye now.